Now let me turn to President Crawford, president of Fran's alma mater and my alma mater, Miami University. Miami has been aggressive in what it's been doing, and Dr. Crawford, if we get you up on the screen, are you with us? Dr. Crawford is with us. Well, we'll see, Eric, if Dr. Crawford is there. If not, we will.
Can you hear me? Yep.
Yep, we can hear you, Doctor.
Can you see me okay?
Now we can see you. So Dr. Crawford, thanks for joining us from Oxford. And, you know, I know you've been aggressive in regard to testing, and kind of tell us where you are. You had kind of a different timetable in regard to starting on, I think you started all online. Is that correct?
That's correct, sir.
And so just kind of walk us through what has been your experience in regard to the COVID virus and how you prepared for it, and frankly, what you're seeing right now and where you are.
Sure. Well, thank you so much, Governor DeWine. It's great to be with you today. And thank you so much for your leadership and keeping Ohioans safe and healthy. We're deeply grateful for all that you do for all of us. And we are sending our best wishes from Oxford to our First Lady, Fran. But let me start off by saying a few things about our gratitude and what we're doing in collaborating with Chancellor Randy Gardner of the Ohio Department of Higher Ed, and with the presidents of our state institutions, with the Inter-University Council of Ohio and its president, Bruce Johnson. Through our collaborative efforts with our public university colleagues, a return to campus plan was created with broad input across all the universities that included 24 categories with baseline health protocols. These protocols included some most recent science information and practices, and at Miami, we incorporated all these into our Healthy Together plan for our reopening strategy. We work collaboratively and frequently with our health commissioner, Jenny Baylor, and her dedicated staff at the Butler County General Health District, our partners at TriHealth, and the city of Oxford to implement our institutional plan and to help protect our university community and the residents of Northwest Butler County. Well, we began this semester with the vast majority of our undergraduate students being taught remotely. Our first and second year students are not scheduled to begin moving in to the residence halls until September 14th. And then in-person classes and hybrid classes will begin on September 21st. That being said, we currently have a significant number of students living off campus in the Oxford community. And even though our first and second year students have not returned to campus yet, we have seen a spike in COVID cases among our students living off campus. We now report 704 positive COVID cases, and we are thankful there's no hospitalizations. But in the short time frame, this surge of cases really demonstrates the aggressive nature of this virus. And in response to this spike, and working together with all of our partners, we have increased our testing strategies and have taken other actions. Testing broadly is so important here. In partnership with our TriHealth health provider, we have the capacity to test now over 3,000 individuals each week through wide net and surveillance testing. This is in addition to diagnostic testing of persons who are presenting symptoms. These two approaches help identify asymptomatic individuals who are positive or potential clusters of positive cases. The wide net strategy allows us to test individuals who have been potentially exposed to the virus, but perhaps not have been identified as a close contact through the tracing processes. And on the surveillance side, testing identifies a sample of individuals for testing, even though they are not symptomatic or identified as having close contact with a positive individual. So we are also investing in a technology that can provide test results within 15 to 20 minutes. And once operational, it'll further enhance and advance our testing strategies here in Oxford. And in addition to all this testing that we're doing, we are also aggressively applying other strategies to flatten the curve and reverse our trend. First, we are grateful to Butler County Health District for aggregating all of our tests from all testing sites. So not just our healthcare partners, but also to have a more complete count of positive cases across all of our students. That's very important. Second, Butler County Health District has also hired many more contact tracers. Miami provided 80 of those, 15 more came from the Ohio Department of Health, and more are being trained. And contact tracers really enable us to more quickly quarantine and isolate students to help slow the spread of the virus. And then in conjunction with advice of the Butler County Health Commissioner, we are emphasizing the importance of staying home this Labor Day weekend. And as you have pointed out, Governor, hunkering down this weekend will greatly minimize the potential for further spread of the virus. We continue to educate our community on the importance of wearing face coverings, maintaining physical distancing, practicing good hand hygiene, and limiting gatherings to 10 or fewer people. And our city of Oxford has passed aggressive ordinances around mask wearing and gathering size. And the city of Oxford has also launched a great video, including Miamians, on their healthy campaign. Engaging all these strategies consistently, we can help reduce the spread of COVID in our community. We are working very hard to flatten the curve and turn over our current and very concerning upward trend. And our greatest concern is the health of our students, faculty, staff, and community members. And we are doing everything we can to ensure that we are all healthy together. And I want to thank you, Governor, for this opportunity to share this update with the great state of Ohio. Thank you.
Well, Dr. Crawford, Fran and I have a grandson who is first year and granddaughter who's second year. And I'm sure they would want me to ask you the question, what's it looking like for moving in?
So our move-in date is scheduled for September 14th, and then in classes will start on September 21st. And so we notified the community yesterday. We're going to watch those metrics carefully over the Labor Day weekend. And then we'll actually let everybody know in the Miami community no later than next Wednesday on how we're doing, where we sit, and how we move forward together.
Mr. President, I notice I'm looking at a release from Butler County Health Department. One of the things I kind of underlined here, urging members of the community to be responsible, avoid parties, large gatherings, noting that the state of Ohio saw an increase in cases following Memorial Day holiday weekend. And that talks about staying put, which I guess is your message. And I know you've been communicating a lot directly to your students. Kind of two-part question. One, what do you attribute the spread on campus to or off campus? It's in Oxford at least. And what's your message to Miami students?
Yeah, so early on when students started moving back to Oxford, even though we started online and remote, upperclassmen moved back. And those early weekends in August, we saw an uptick in parties and gatherings. And so I think that's what's responsible for the surge today. And so our message to students is we put a lot of protocols in place to keep everybody safe and healthy. And now as individuals, in order for each of us to be healthy, all of us have to be healthy. And so take the individual responsibility to wearing your mask, do your social distancing, and just be very careful out there and to be safe and to be healthy, and to know that in order for us to get back to campus and to have a successful semester, we're going to have to follow all the protocols and guidelines that have been set forth by the state of Ohio and also the CDC.
Doctor, thank you very much. We wish you and all your team at Miami University and the students well. Hope you have a great year.
Thank you, Governor.
Thank you. Appreciate it.
Thank you.